Hi, in our video talking points this week I wanted to talk to you about staffing the unit. And there's two reasons I wanted to talk to you about this. One is that we had a kind of a disturbing patient complaint, and the other one is some conversations that some of you had with our patient safety officer indicating that there were problems with how we were staffing the unit. As far as the patient complaint goes, it was where there was a lack of nursing care for this patient. And I think there were two root causes to it. One of them was that the plan of care was not well communicated between the RN and the CNA. And so I just want to remind you that it's an important part of our report process that we talk to each other shortly after the beginning of the shift and communicate what the plan of care is between each other. The other root cause was that there was an incredible intensity of nursing care needed, and this wasn't communicated beyond the team trying to take care of the patient. The charge nurses were totally unaware that the nurses were unable to complete this assignment. So it's just so important that you keep your charge nurse informed on what's going on and ask for help when help is needed. We we staff according to the numbers. You know, we staff by a matrix. That's step one of staffing. So we look at how many patients we have on the unit, and we staff based on those numbers. But the second thing we do, that's only step one. Step two is we staff by acuity and intensity of nursing care required. Now, the only way the charge nurses know about the acuity and the intensity of nursing care required is that staff nurses have told them about it during charge nurse report. So it's so important to communicate these things of what it is that's taking a lot of nursing time to your charge nurse when you're giving report. And the next thing that we're going to do is we're going to have a period of a couple of months where we're going to track some data on how we're doing on just basic nursing care. So for this period of time, I want you to think about it as being amnesty or forgiveness, and I want you to be absolutely honest about what's going on. So if baths are being missed, if patients aren't getting walked, if we're not feeding patients in a timely way, if PRN meds are taking longer than 15 minutes, and some other things that the charge nurses will be tracking, just let them know. We weren't able to do 4 of our baths today. We weren't able to ambulate 3 of our patients, or whatever the case may be. Charge nurses will be collecting this data, and then we'll be sharing it with leadership. The other thing I want you to do is make sure if you have to stay overtime to finish charting or to finish something up, make sure you're charging for that overtime, because we're going to be tracking that also. Thank you for your time today, and go ahead and go out there and have a great shift.